Over a 10-year period ending in 2015, 1 million Americans died from alcohol or drug abuse and suicide. Oklahoma is currently ranked 14th in the nation for the number of people who died from one of those three causes. While still facing issues of funding, there is a plan to avoid predictions that the death rate here will continue to increase.
The Pain in the Nation report predicts that another 1.6 million Americans could die from drugs, alcohol, and suicide during the next decade, a 60% increase from the previous 10 years. Benjamin Miller is Chief Policy Officer of the Wellbeing Trust, which took part in the study.
If these trends continue, Oklahoma's drug, alcohol, and suicide death rates could increase by 38% over the next 10 years.
The study calls for a new national initiative to develop a comprehensive plan to avoid the increasing death rate.
If we really are truly going to change the tide of some of these epidemics, it begins at home.
At Norman Regional Hospital, several of the state's top health care officials talked about that very issue, how to improve health care across the board in Oklahoma. Craig Jones, president of the Oklahoma Hospital Association, says the state is currently ranked 46th in the nation for the health of its citizens, and there are numerous other health issues also claiming lives.
We are 5th in infant mortality, 7th in cancer deaths, 8th in obesity, 9th in the percent of adults with diabetes, 3rd in terms of heart disease-related deaths.
And 15% of Oklahomans have no access to health care insurance of any kind. 70 of the state's 77 counties are listed as not having enough primary care providers. The state also has 1,300 nursing positions unfilled each month. And of those working in nursing, over 30% are approaching retirement age or are there already.
Even while OU, that puts out about 160 grads a year, in OSU about 100 grads, Oklahoma will remain as one of the top 10 states with a shortage of primary care physicians over the next 6 to 8 years.
For Terry White, Oklahoma Commissioner for Mental Health and Substance Abuse Services, there is another recent study, the Adverse Childhood Experiences Report, that shows where the real effort to address drugs, alcohol, and suicide should begin.
It was looking at why do people with the most complex health needs, including obesity, including all kinds of negative health outcomes, what is the one root that was common in all of their disease? And you know what they found? Because they were shocked, and the rest of the nation was shocked. It was that they all had serious adverse childhood trauma.
However, in the field of mental health and substance abuse, Oklahoma faces another severe workforce shortage.
When it comes to behavioral health, we are actually on the National Registry of Emergency and Crisis for actually most of the time every county in Oklahoma when it comes to the behavioral health workforce. But we never come off for any rural county.
There are some bright spots. One way the Mental Health Agency has addressed a lack of trained personnel and services is to tap into technology.
What we have to do is increase the use of technology to get to rural Oklahoma. What we have, the Department of Mental Health and Substance Abuse Services in the state of Oklahoma, something you'd be really proud of, we have the largest public mental health telemedicine network in the entire United States.
With 1 in 4 Oklahomans needing mental health or substance abuse treatment, it will still take more than technology to meet that need.
Our medical schools have to do an increasingly better job at training everyone coming out of, and I say medical school, it's not just physicians, but nurses, physicians, all areas have to come out with more behavioral health knowledge than they're coming out with right now.
But with every solution comes the need for more money to pay for the programs, people, and technology. And even though the state budget for the Mental Health Agency has been protected from large cuts, the agency has lost over $51.5 million over the last 3 years.
And all that meant people losing services. So the idea that we can continue to do this without revenue, I think is ludicrous, to say the least.
Mark Rogers with the absentee Shawnee Tribal Health System told the crowd that Oklahoma already has a plan that, if followed, will address the issues of suicide and drug addiction, along with Oklahoma's other health problems.
There's an Oklahoma Health Care Improvement Plan 2020, and that's your roadmap. That's where the state has come together, and there's been a lot of resources and a lot of very intelligent people throughout the state that have come together and put this plan together to kind of focus the communities. It's how the communities can get involved, and all these issues are delineated in the plan.
State Senator Irvin Yen, who is also an anesthesiologist, says there is no way the current legislature can increase funding to pay for the new programs because of the state law mandating a 75% approval margin in both houses. He says even if there is opposition to changing that, it's time to go back before voters to try and lower the tax increase threshold.
Maybe with this fiasco we've had the last 2 months in special session, maybe the public would vote to get rid of the 75% rule and make it maybe 60%.
Since 1999, a study by the Commonwealth Fund found the death rate of Caucasian adults in America has doubled. The main reasons? Overdose, suicide, and liver disease associated with alcohol abuse.